So speaking of cancer care, we are witnessing genomics playing the role of a catalyst in making the treatment more convenient. Genome sequencing is providing physicians with more data about the causes of cancer and changing the way some forms of the disease are treated. To set context, genomics refers to the study of changes that occur in the genes of living cells. In the context of cancer, that is the analysis of the mutated genomes of tumor cells. Genomic sequencing will be able to provide important information to doctors and enable them to provide better care for their patients. I am in conversation with Dr. Poovamma C U, Senior Consultant and Director, Breast Oncology, Cytecare Cancer Hospitals. It is a good opportunity for us to delve deep into the potential of genomic sequencing and find answers that only advanced technology can help us find. What are the tools that can enable us identify specific mutations for emerging cell therapies and vaccines that can be personalized for individual patients? New tools are also being developed to improve the way tumor genomes are analyzed. With over a decade of experience in cancer care, Dr. Poovamma is also the first graduate of the Fellowship in Breast Diseases in India. Among her many accolades, she also specialized in aesthetically conserving the breast for malignancies. She is certified in pain and palliation to provide a holistic approach to the treatment and rehabilitation of cancer patients. She is also the faculty for fellowship in breast diseases and cancer, Rajiv Gandhi University. She has also been credited with several publications and paper presentations, both in national and international journals and conferences. So, Dr. Poovamma, thanks for being with us. I will directly jump to our questions that we have in our mind. So, in India, we see more cases being presented in advanced stages. How important is early detection of cancer?
Hi, thank you for having me here. I think with any like with any other disease, when we detect cancer early, when it's localized to an organ, the long-term outcomes are better. With later presentation, we give chance for the cancer to spread and the outcomes are worse. For the simple, if you look at it like this way, when cancer is localized or say early, and we are talking more perspective with breast cancer, with early breast cancers, the cure rates are as high as 95 to 96% with complete treatment, versus it drops to about 20 to 25% for a stage 4 breast cancer when it's spread. And I think that's where the huge gap we see with cancer care in India versus the Western world, because most of our cancers are detected late. We don't have screening programs. And like you said, all cancers are getting detected in advanced stages.
And from your comments, it's clear that early diagnosis is crucial. So is there a role that technology plays in early diagnosis?
So technology definitely does play a role. Like for breast cancer, one of the few cancers which we can detect way before the symptoms are present, way before a woman could realize, there's something wrong in the breast. And the key to that is screening. And we lack screening programs in India. It's more of an opportunistic screening when women come in with some symptoms, and that's when we, do the test to detect them and identify cancer. So I think having a robust screening program and maybe using technology to leverage that will play a role, because as of today, the gold standard for screening for breast cancer remains a mammogram, and that is still can be done only at a hospital setting. We don't have something which we can take to the masses, and detect cancers in the masses at an early stage. And I think that's where technology is coming in. There are a lot of studies going on to see, can we use any other screening modality which can be done at home in a community setup to pick up cancers early. And I think that's what everybody's trying to do today.
That was well laid out by you. And in terms of advancements in this space of technology for early diagnosis, how important is genetic testing, and what role does it have in choosing the right treatment or recurrence of cancers?
So see, all cancers are because there is a mutated gene. The only difference is whether it's a germline mutation or a somatic mutation, meaning to say whether it's germline, have you inherited the mutated or abnormal gene, or has the mutation occurred at the tumor level. So I think one thing when we talk about genomics, what we should get across to the world is that ultimately genes are responsible for cancer, but that doesn't mean all cancers are hereditary. Okay, a very small percentage of cancers are hereditary or familial. That means cancers running in the family. So just because you don't have a family history of any cancer doesn't mean that you're not going to have cancer. Hardly 5 to 10% of cancers are because it's hereditary or familial. Most other cancers, yes, the mutation has occurred at the genomic level or at the genetic level because of environmental factors and so many other things which have happened in their lifetime. And as medical science has progressed, we've seen that we started studying the tumors at the genetic levels, and we started to realize that when particular genes are mutated, there are certain reasons as to why they occur early or why they're more aggressive. And it's also helped us to treat certain different kinds of cancers, in the sense when certain genes are mutated, we have specific treatment for that. So basically we're trying to start to personalize the treatment as to the kind of tumor they have. It's not one size fits all. We go down and study the tumor at the genetic level and see, okay, what are the key genes, which are abnormal in this tumor, and try to see whether we can treat that and target that.
Got it. And just digging a little deeper on that topic, why is it important to tailor or customize treatment for the individuals? And what is the best role of a multidisciplinary approach in diagnosis and treatment planning? So, for instance, is there a best way to decide surgery, radiation, chemo, hormonal, or combination therapy?
So I think at most cancer institutes, we have a multidisciplinary or MDT tumor board meeting where all patients are discussed. So cancer is not treated by one individual department. So most cancers have a role of surgery. There's a role of chemotherapy or targeted therapy, immunotherapies, or a lot of the other newer agents. We have radiation. We include the radiologist. We need the pathologist. So instead of having the patient go from room to room to room, the patient's case file is brought into one room where doctors from different modalities sit together. So at one sitting, we can look at the images, we can look at the pathology, we can look at what additional testing has to be done, or so you have multiple heads coming in to look at one tumor, one cancer, and see what is the best way to treat. And most cancers today, the treatment is very, very well driven. It's not about how I want to treat it. There is proper guidelines of how each individual type of cancer is treated, whether it's depending on the molecular subtype and depending on the age. We have different ways where we can look at it and say, okay, this is the best way we can treat this tumor. And that's how an MDT meeting helps, because you're getting inputs from the medical oncologist, you're getting inputs from the surgical oncologist, you're getting inputs from the genetist, you're getting inputs from the pathologist, and from the radiation oncologist and the radiologist. You have multiple heads coming in, studying one patient and seeing, okay, which is the best way we can treat it. And that's how I think an MDT helps.
Yeah, very nice. And I think you're saying there is a process that is established. And I just wanted to jump into breast cancer again. Breast cancer among Indian women, which is obviously on an exponential rise, and its incidence has overtaken, uterine, cervical cancers. So breast cancer in India is seen by GPs, surgeons, surgical oncologists. So keeping all that in mind, do you think India needs more dedicated breast centers? And should it be treated as a subspecialty for better outcomes? What is your take here?
Definitely and yes to that. And I think in most of the Western world, they've already moved into dedicated breast cancer or a breast unit. There have been studies even done from Tata Memorial in India, which has shown that when breast cancer is treated by the subspecialist, the treatment outcomes are better, the surgical outcomes are better. And yes, but India is a huge country, and I think we're still a long way in coming to that. But I think outcomes are going to be much better if you have a dedicated unit for breast cancer.
Got it. So, I will leave you with an open-ended question. What is the road ahead?
I think the road ahead is, we're talking about genomics today, which is actually a very, very long way, I think, to the common man. Sitting in the OPD, I have seen extremely educated women coming in with advanced stages of breast cancer for the simple reason they do not know what are the symptoms of breast cancer. And the most common things I hear are like, I've seen this tumor or a lump in the breast. It's not painful. It's not causing me any trouble. So I pushed it. Or I was busy with work. You get such kind of answers from educated people, and I think that's what is sad, because people still think cancer means you have to be really unwell, you have to be vomiting, or you have to be nauseous, you have to be bedridden to have cancer. And they don't realize that most early cancers are very few symptoms. They come with very few symptoms, and we're losing that time, from the time they've actually identified the problem to when they come to the doctors, usually a span of 6 months, 8 months, 1 year. And I think that's the key message I need to take to the people out there, that, you find something abnormal, you don't push it, you get it evaluated.
Yeah, clearly there's a lot of work to be done on awareness.
Yes.
So with that, I'm done with my questions.